An accountable care organization essentially is formed by a group of physicians and hospitals that jointly contract with typically managed care organizations to provide the full gamut and range of health care. And the hope is that we'll provide better, more consistent, coordinated, comprehensive care at a lower cost.
When an individual with a chronic condition like CHF comes, the primary care physician can, in this network, add extra resources. They typically will call me or one of my case managers, and we'll put them in our disease management program, which will give extra home nurse visits, extra education, extra monitoring. I, as a consultant, will help with the care delivery, and then when they need hospital care, which is less often because we do more prevention, they'll come to Mercy and they'll know the team already, and the care is integrated.
It differs substantially from traditional health care in that our accountable care organization essentially perfectly aligns the needs of the patient, the physician, and the hospital, in the sense that the hospital and the physicians are rewarded for keeping patients healthy.
The different care providers need to spend a little more time with each patient. The system allows them to have support for that, financial and other support, so they can spend more time with the patient.
We certainly are deeply involved in disease self-management, home-based management. We work very closely with our Visiting Nurse Association, our home health organization, to do disease self-management training in the home.
The visiting nurses are out there, assessing the patients. Like I said, they're our eyes and ears, and they'll do a full assessment of the member's healthcare needs, the clinical aspect, and then they'll report back to us what the patient actually needs for a plan of care. And it's our job to reinforce what the visiting nurses have taught them.
3 years ago, I got pneumonia, and that started me off. But I wasn't too bad until just about a year ago. I kept getting bronchitis. And then Cindy started coming because I had this lung disease. And God, I'm glad she's here. She's a great advocate for me. I don't know what I'd do without Cindy.
I try to make sure they know how to take their medications, when to take their medications, and through the tools and through teaching, they learn how to take care of themselves.
The nurse usually can walk in and see that there's a problem right away and be on the phone immediately to Dr. Gaziano or one of his covering.
Physician knows what medications the patient is on, is able to adjust the medications, has seen whatever the problem is that the patient's having before, has seen it even in that same patient. So he said, well, Mary, the last time this happened, what we did was this, and you didn't have to come to the hospital, so let's try this. And indeed, it works. We've actually achieved what Medicare has said is the holy grail in terms of readmissions. So for instance, in unmanaged Medicare, about 20% of patients who are hospitalized are readmitted within 30 days. At Mercy Medical Center, 9.8% of patients are rehospitalized within 30 days. Remember, you're talking about millions of patients when you take this nationally, so to cut the rehospitalization rate by more than half is a huge accomplishment, and I think it largely is because of the medical home and the continuity of care.
Once we implemented this integrated infrastructure, we started seeing cost savings of first 15, then 20, now 25% of the yearly budget. And we've seen that. At the same time, we've seen our HEDIS scores, our preventative scores, our mortality scores get better. Therefore, this model, I think, will be looked at favorably by every community, and I think is the solution for healthcare delivery for the future.
I'm sure you agree that these pilots are helping to reshape the definition of what a healthcare delivery system is and should be. The benefits that our Healthcare Vision 2017 of person-centered care promise for all of us. On behalf of the entire Catholic Health East family, thank you for joining with us as we build a bridge to a brighter healthcare future.